This is lecture number 4 of 6 lectures on renal disorders. By the end of this lecture, you should be able to answer these questions. What is glomerulonephritis? What are the causes of and the risk factors for glomerulonephritis? How is glomerulonephritis diagnosed? How is glomerulonephritis managed? And what are the complications of glomerulonephritis? What is glomerulonephritis and what causes it? Glomerulonephritis is an inflammation of the glomeruli of the kidney. It is the third leading cause of kidney failure in the United States. What are the risk factors? One is streptococcus infection and autoimmune response or disorders. At the top of this slide, you see the renal corpuscle with the glomerulus within the Bowman's capsule. You can see the glomerulus within the Bowman's capsule. If we cut through this section, you will see this bottom picture. In this bottom picture, you see basically 3 layers. The innermost layer, this one, which lines the lumina, is the fenestrated endothelium. In other words, this is lined by endothelial cells with fenestrations or holes. The second layer you see is the GBM, or the glomerular basement membrane. And the important thing to remember is this GBM is negatively charged. And then the third layer are foot processes or podocytes. What happens in autoimmune glomerulonephritis is the antibodies or the antigen antibody complexes are deposited in the basement membrane and foot processes. When that happens, the basement membrane loses some of its negative charge and the foot processes are set farther apart. All in all, they become leaky. So these then become permeable to large molecules such as albumin and other proteins and even red blood cells. What does this tell you? You have protein in the urine and you don't have much protein in the blood. So what are the signs and symptoms of glomerulonephritis? You have decreased urine output and protein in the blood. You will also see edema. Why edema? Remember that proteins in the blood are responsible for oncotic pressure. What is oncotic pressure? The presence of protein in the blood helps fluid remain in the blood vessels. Think of proteins as sponges. Proteins will try to keep the fluid within the vasculature or vasculature. Without the proteins, then you will see periorbital edema, generalized edema, ascites, and peripheral edema. Sensing hypovolemia, the renin-angiotensin aldosterone system kicks in and brings about hypertension. How is glomerulonephritis diagnosed? With medical history, like I said, you will see edema and hypertension. Urinalysis will show protein, red blood cells in the urine, and white blood cells if there's infection. The labs you will see increased BUN, increased creatinine, and decreased albumin in the blood. How is glomerulonephritis managed? Penicillin for post-streptococcal glomerulonephritis. Um, with regard to the heightened immune response, uh, plasmapheresis may be done to get rid of the immune complexes in the blood. Corticosteroids to modulate the inflammatory response, and supportive care for edema like monitoring through daily weights, inputs and outputs, or INOs, abdominal girth, fluid restriction, salt restriction, and diuretics. Diet is low to moderate protein, and antihypertensive drugs to manage hypertension. What are the complications of glomerulonephritis? Acute kidney injury or chronic kidney injury may develop. This ends the lecture on glomerulonephritis. Please read your textbook on glomerulonephritis. This ends lecture number 4. Lecture number 5 is on chronic kidney disease. Thank you.